Welcome back to the Rena Malik MD podcast. I'm your host, Dr. Rena Malik, urologist and pelvic surgeon. Today we are doing an episode of Ask Me Anything. We've pulled these questions from our special members who signed up for the premium membership at Supercast, which is renamalik.supercast.com. You can also feel free to leave me your questions on social media. We do see these, so follow me on your favorite social media platform, Instagram, YouTube, TikTok, Facebook, wherever you are, you will find me and you can leave me comments there. So let's get right to it.
First question. I pee, but even after I'm done, I shake it off at the toilet. I always find some pee leaking out when I put my underwear back on. How do I fix this?
Okay, so this is called post-void dribble or after dribble. So this is very, very common. About 2/3 of men experience some post-void dribble or after dribble. And why does this happen, right? It's pretty annoying. It's definitely really annoying. For most men, this is one of the most annoying things they deal with, and they are just want it to stop, right? And so why does this happen? First off, this happens because of a few different reasons. Most commonly, it's because you have an enlarged prostate. So all men have a prostate, and as you age, it tends to enlarge. And when it gets larger, it can actually block the flow of urine because as it enlarges, it sort of pushes on the urethra or the P tube and makes that urethra a little bit more narrow. So I describe it typically as if you were drinking from a straw. If you drank from a boba tea straw, it's pretty easy to drink. But if you drank from a coffee tea straw, it's pretty difficult. You got to suck a little harder. So similarly, if you have a narrow urethra, your bladder has to push a little harder to get urine out. And what happens also is that some of the urine gets stuck behind the prostate. And so when you finish peeing, later that urine can come out. What can you do about it? Well, you can take medications to relax the prostate, to allow urine to flow better. And these are a variety of different medications called alpha blockers, like tamsulosin or alfuzosin, that help relax the smooth muscle of the bladder neck as well as the prostate to help urine flow better. You can also take things like finasteride or dutasteride, which are medications that shrink the prostate, as well as daily tadalafil, which we just talked about. There's also some natural things you can try to do to prevent enlarged prostate. The big ones are exercise, moderate intensity exercise, 150 minutes per week, as well as increasing your vegetable intake and taking in lycopene, which is found in tomato products and watermelon. And you can eat more of that. And also cooked tomatoes can be very helpful. But I've made a full video on that, so make sure you check that one out as well. The next reason for this is a narrowing. So it can be an actual narrowing in the urethra that's caused by maybe you had trauma to the area, like someone kicked you, or you fell on a bike seat, or you fell on your crotch somewhere. Or it can be due to having a procedure. So if you've ever had anyone put anything in the urethra, it can develop scarring if there's not enough lubricant, or if it, for a variety of different reasons, it can lead to scarring. And so that can make it more difficult to let go of all the urine, leaving this a little bit behind for post-void dribble. The other thing is sometimes you just have a weak stream, and that can happen with age too, in addition to having a large prostate, but sometimes that's because the muscles around the urethra are a little bit weak with age. And so sometimes doing Kegel exercises or strengthening those muscles around the urethra can help you empty the bladder a bit better and also prevent this post-void dribble. I've made 2 videos on this before as well, so if you want a more in-depth discussion on this, check those ones out.
All right, next one. My boyfriend wants to have anal sex with me. I am scared. I've never done this before. I'm not sure if there's anything I can do to make it less painful. I do want to try it, but I'm too nervous.
Okay.
What do you think?
Anal sex. So one, obviously consent is super important. If you want to do it, that's great. If you don't want to do it, it's okay to say no. In terms of what things you should do to do it safely, one is you want to make sure that when you start, you would probably not start immediately with penetrative anal sex. You want to sort of work your way up in terms of trying things to make sure you're comfortable. So usually you want to start with some sort of either well lubricated finger or a well lubricated toy, like a butt plug of some kind, and sort of start with smaller objects and work your way up so that you can, one, feel comfortable and be sort of prepared for the eventual penetration. Always want to make sure that you're using lubrication because the anal tissue has no lubrication, not like the vagina where it makes its own lubrication. And so those tissues can get injured very relatively easily. And so you want to make sure that you're well lubricated so that you don't cause injury to those tissues. You also want to sort of go slow and work your way up very slowly. Always sort of communicate, make sure that if there's ever discomfort that you both agree to stop, and make sure you have ground rules very early on in the beginning before you proceed with having any sort of anal penetration. And lastly, and most importantly, use a condom. The reason is that anal sex, while you cannot get pregnant through anal sex, you can still very easily get a sexually transmitted infection. And it's actually more likely in the anus than through vaginal penetration because, as I mentioned, those tissues are super thin and very easy to bleed if you're not being careful. And so that puts you at higher risk if someone is infected to then contract that illness. So always use a condom and be safe.
Once again, make sure this is with consent, guys. We don't want to be having anal sex or any kind of sex without consent.
Absolutely.
All right. So last question. My dad and uncle both got prostate cancer. How can I prevent this since it looks like I have some family history going on with this problem?
Okay, prostate cancer. So in terms of prevention of prostate cancer, there's a lot of literature in studying prostate cancer. And the big things that help prevent prostate cancer are basically the things that keep you healthy. So exercising, moderate intensity exercise of at least 150 minutes per week of getting moderate intensity exercise, as well as eating a healthy diet. And that includes a sort of lot of vegetables, reducing processed foods, reducing sugar, reducing red meats. All of those things have been shown to ideally reduce your risk of getting prostate cancer. Maintaining a healthy weight can be very important. We know that obesity is linked with higher rates of prostate cancer, so maintaining a normal weight is helpful. There's one small study that has shown that ejaculating 21 times or more per month was correlated with a lower risk of developing prostate cancer. Now, does that mean everyone should ejaculate regularly? No. I mean, I think what it means is that likely people who are ejaculating more frequently are probably cleaning the pipes, so to speak. And so ultimately there may be some benefit to that. And so if you are having frequent ejaculations, that's certainly not harmful, but I wouldn't try to sort of aim for that number if you are not getting there. And lastly, there's some data on lycopene. So lycopene, as I mentioned before, is helpful in prevention of BPH, but it's also helpful for prevention of prostate cancer. So they've seen that lycopene, particularly in things like cooked tomatoes, has shown some benefit in prevention in association with lower risks of prostate cancer. So that's a reasonable thing. If you like tomatoes and you like pasta or you like cooking tomatoes and other foods, that's a great way to sort of reduce your risk. So the more important thing is if you have a first degree family relative with prostate cancer, you do need to start getting screened earlier. Now the guidelines vary from association to association, but generally we say as early as 40, you should be getting screened. And what that means is getting a blood test for PSA, which is to evaluate a serum marker, which is prostate specific antigen that's released by your prostate. Now, high levels of PSA are correlated with cancers. And so that's why we screen with this test. Now, high levels can also occur because of infection, because of inflammation. I wouldn't worry if you got a high level just one time, but generally speaking, it does warrant further investigation. There's also a digital rectal exam, which I think people argue both ways if it's valuable or not. I still think it's a very reasonable test to do if you feel comfortable to evaluate for any lesions or masses in the prostate. And I've made videos on what that feels like and how that goes, so you can check that out. But ultimately, it's something that allows us to see if there's anything palpable in the examination that may be concerning. But ultimately, the PSA is the most important test. So at the very least, get that and get screened early if you have a family history. Thank you guys so much for joining us today. If you guys enjoyed this and want to hear the rest of it, make sure to sign up for our premium membership at renamalik.supercast.com. We also answer questions from our premium members first. So if you want your question answered, make sure to sign up for our membership. And as always, remember to take care of yourself because you're worth it.